Welcome to Module 2 of our prescription reading series. Today you'll learn how to decode the most common and sometimes confusing abbreviations used by doctors on prescriptions. Abbreviations save time and space, but if misread, they can lead to harmful or even fatal mistakes. Let's break down the most common Latin abbreviations you will see on prescriptions. These are critical to understand because doctors and prescribers use them every single day. OD stands for omni die, which means once a day. You'll usually see this on maintenance medications like antihypertensive. BID comes from BIS and die, meaning twice daily, typically about every 12 hours apart. For example, an antibiotic might be dosed BID to keep blood levels steady. TID or tur and die means 3 times daily, roughly every 8 hours. Common with pain medications or short-acting antibiotics. QID is quarter and die, which means 4 times daily. That usually means a 6-hour interval, such as for certain eye drops or antibiotics. HS stands for horisomni, meaning at bedtime. This is often seen on sleep medications or drugs with sedative side effects. PRN is short for pro re nata, which means as needed. For example, paracetamol PRN for pain, where the patient only takes it when symptoms occur. SOS means if there is an emergency. From the Latin see opus sit. Used rarely but good to know, such as in prescriptions for severe allergic reactions. Stat comes from statum, which means immediately. This is urgent, like for emergency injections. PO means per EOS, or by mouth. It's used for all oral medications. Besides frequency abbreviations, you'll also see short forms related to routes of administration and dosage forms. Let's go through them one by one. SC stands for subcutaneous, meaning the medicine is injected just under the skin. Insulin is a classic example given subcutaneously. IM means intramuscular, where the medication goes directly into the muscle. Vaccines like tetanus toxoid are often given this way. IV is intravenous, which means directly into a vein. This is the fastest way to deliver a drug into the bloodstream used in emergencies or hospital settings. SL stands for sublingual, which means placing the medicine under the tongue for fast absorption. Glyceryl trinitrate for angina is a classic sublingual medication. GTTS means drops, from the Latin gutty. You'll see this commonly on eye or ear drop prescriptions. OINT stands for ointment, which is a semi-solid preparation applied to the skin for local effects. Ung is the Latin word unguentum, meaning ointment. You might still see it used, especially in older prescriptions. These fractions help the prescriber note how long the treatment lasts. Just remember, 7 means days, 52 means weeks, and 12 means months. The /52 means weeks, because there are 52 weeks in a year. Okay, here's your first practice question. What does this prescription mean? Pause the video and think about it. The answer is 1 500 milligram capsule of amoxicillin 3 times daily for 5 days. Paracetamol 500 milligrams 2 tablets PRN. What does PRN mean and how should the patient take it? The answer is 2 500 milligram tablets of paracetamol to be taken as needed, usually for pain or fever. Third question, metoprolol 50 milligrams 1 tablet OD. Can you expand OD? The answer is 50 milligram tablet of metoprolol taken once daily. Last question, ciprofloxacin 250 milligrams 1 tablet BD for 1/52nd. How long is the course in total quantity? The answer is 250 milligram tablet twice daily for 1 week. 14 tablet would be provides. That's it for Module 2. In Module 3, we'll look at how dosage forms and routes are written on prescriptions. Don't forget to subscribe and turn on notifications so you don't miss the next module.